Joseph Murray was born April 1st, 1919, in Milford, Massachusetts, and died November 26, 2012, in Boston, at the Brigham and Women's Hospital, the institution where he intensively worked for several decades as chief plastic surgeon. He became one of the most prestigious professors of the Harvard Medical School and was awarded in 1990 the Nobel Prize on Physiology of Medicine with his colleague Donald Thomas for their pioneering work on organ and cell transplantation in the treatment of human disease. He was appointed a member of the Pontifical Academy of Sciences in 1996. Murray's interest in the biology of tissue and organ transplantation arose from his military experience at Valley Forge General Hospital in Pennsylvania during the war, where he explored new treatments for extensively burned patients using skin grafts. Humanity has a debt of gratitude to his impressive work to save the life of thousands by tissue and organ transplantation. In December 23, 1954, Murray and his team at the Brigham Hospital successfully performed the first kidney transplant in identical twins. This surgery became a landmark in the history of medicine, and as such is represented in a painting at the famous Counterway Library of Medicine in Boston. You are seeing now this nice picture. You see to the left the group, Murray and his wife and the painter, and the painting at the end on the wall is about the first surgery with two teams. One taking the kidney of the brother of the patient, and the other team making transplantation. This was organized and done by Joseph Murray. 54. In his Nobel lecture, Murray vividly described the ethical question that the organ transplant elicited. Quote, "For the first time in medical history, a normal, healthy person was to be subjected to a major surgical operation, not for his own benefit. After many consultations with experienced physicians within and outside the Brigham, and with clergy of all denominations, we felt it reasonable to offer the operations to the recipient, the donor, and their family. Post-operatively, the transplanted kidney functioned immediately with a dramatic improvement in the patient's renal and cardiopulmonary status. This spectacular success was a clear demonstration that organ transplantation could be life-saving. To this first intervention followed other substantial feats. In 59, the first allograft, and in 62, the first cadaveric transplant. At the same time, Murray became deeply involved in the search of immunosuppressive agents to extend the reach of organ transplants, and did a series of groundbreaking research in animals. By the time of his Nobel Award, there were more than 12,000 kidney, liver, heart, pancreas, and heart-lung transplants performed in the United States alone. Today, there are thousands of successful transplantations of solid organs and dissociated marrow cells around the world. I had the enormous privilege to meet Murray at Harvard in 2002. I was teaching with Scott Fisher a course at the Graduate School of Education on the educated brain. And we invited him to give a lesson to our students about his life as a surgeon scientist. We will never forget his talk. It was so deeply moving and inspiring. Of course, some of my students asked for the possibility of brain transplants. He spoke also about his last book with a bold title, Surgery of the Soul, Reflections on a Curious Career. We had several opportunities to talk about his work and discuss about my projects during my stay at Harvard. He was a source of inspiration for many of us. He had a wonderful family. He was married to Virginia Link, Bobby as he called her, and had 6 children. I keep a photo with him at my desk since then. Murray was a man of faith and science, a man full of love, joy, curiosity, and hope. He said, quote, "My life as a surgeon scientist, combining humanity and science, has been fantastically rewarding. In our daily patients, we witness human nature in the raw fear, despair, courage, understanding, hope, resignation, heroism. If alert, we can detect new problems to solve, new paths to investigate." He wanted to send a worldwide message to clinical scientists that their research is just as significant as that of fundamental scientists whose work forms the background of all advances. Let us continue, he said, to shorten the distance from the laboratory to the bedside. End of quote. Many are now walking the path that our dear friend Joseph opened for all of us. Thank you.